RSV, or respiratory syncytial virus, is a common virus that causes infections of the lungs and respiratory tract. In older children and adults, it's a lot like a cold, but it can be very severe in premature babies and infants. Cleveland Clinic pediatrician Dr. Giovanni Piedemonte explains.
When you have a child in the first months of life that has cough, wheezing, retractions, and difficulty breathing, we call that bronchiolitis, and 60 to 80% of cases of bronchiolitis are caused by that virus.
Dr. Piedemonte and his team are researching RSV, and they've discovered some very interesting things about its transmission.
We thought that the only way you could get the virus was by contact with the infected secretions, and so what we call horizontal transmission, so from human to human. And also, we were convinced for many years that the virus could infect only the lungs. And several years ago, we found that instead the virus could go somewhere else besides the lungs. And once we found that the virus can go in other organs, automatically the question came, is it possible it goes through the placenta? And in animals, we showed a couple of years ago that the virus can go through the placenta, and so can go from the respiratory tract of the mother to the fetus, actually finds the way to identify the cells in the lungs of the fetus and infects them. We have several reports from around the world of cases that can be explained only with a vertical transmission. We call it a transmission from mother to the baby. And so it really looks like it happens also in humans. I'm convinced that there are also a lot of babies that are born with the virus, not acutely sick.
This may predispose some children to develop asthma.
What I think really happens most of the times is really that the virus lodges into the lungs of a baby and interferes with some mechanism of the lung development. So I see this more as an element that can predispose the child to develop recurrent wheezing, airway obstruction, and potentially asthma.
Currently, there is no therapy or vaccine for RSV.
We do have antibodies that can block the virus. Those are antibodies that usually we give to babies that are born prematurely because they have a higher risk of developing severe disease from RSV. The issue is whether we should give those medications to the mother. The virus is just one component of a larger hypothesis, which is that virtually everything that happens in the environment during pregnancy has substantial implications for the development of the fetus.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.